Hello everyone, I am Muyco from DSN 12C. Today I will be doing a return demonstration of female urinary catheterization. This is applied to those people who has problem urinating naturally or to empty their bladder. So first step is you have to verify the doctor's order for catheterization. This is to verify the doctor's order. And after that, perform hand hygiene. This is to prevent the spread of microorganisms. So next, after hand washing, we have to introduce ourselves and verify the client's identity. This is to make sure that we have the right patient, and after that, explain the procedure as well to gain client's cooperation and to reduce client's anxiety. So, hi ma'am, good morning. I'm Muyco, your nurse for today. May I know your name, ma'am? How about your birthday po? Okay, thank you. So, for today, ma'am, ang atong buhaton is urinary catheterization. So, mag-catheter ko sa imong perineal area para makaihi ka og tarong. Okay naman to sa inyo, ma'am? Okay, thank you. Tapa ba kailan po ang ma'am? Okay, wala na. Okay, thank you. So, after explaining the procedure, we have to provide privacy. This can be done by closing door or windows to provide clients integrity and position the patient in a dorsal rectum bend with the knees flexed. This is to provide comfort to the patient. So, ma'am, pwede ka mag-taas mo rin yung mga, mga tugod, ma'am, dahil ka lang. Okay. Assist lang ka, ma'am. After that, drape the patient, exposing only the area to be used. This is to avoid chilling and to lessen the embarrassment. So, ma'am, i-expose lang na po ang ilang perineal area. After that, you have to apply direct light for visualization of genital area. This is for better visualization. After that, you have to open the tray and arrange equipment for convenience and accordingly to avoid any contamination. This is to maintain its sterility of the equipment. So, I already opened and prepared the materials and equipment that we have to use. So, next step is using the sterile forceps, cleans the area using cotton balls with betadine. So, like this. Then down to anus, then discard. Discard. And repeat to the other side. And after cleansing the area, we have to open the set and also observing sterile technique. This is to maintain its sterility. After that, we have to put the sterile gloves. This is to prevent contamination and to maintain the sterility of the set. So, let's put our gloves. And after that, put ahead and put the eye sheet. So I have here the eye sheet. So after that is you have to lubricant the catheter for about 1 to 1.5 inches, being careful not to plug the eye of the catheter. So let's open first the catheter. So I have here the catheter. So I have the lubricant. So since this is sterility, we have to maintain sterility. So we just imagine that all of way is sterile. So since we don't have enough equipment, you have to lubricant. Make sure that the plug of the eye of the catheter full of lubrication to have smooth insertion and to prevent discomfort. So now I will put lubricant. So after that, pick up the catheter at least 3 inches from the tip of the thumb. Place the thumb and one finger of the left or right hand between the labia minora. Separate and pull up gently. Separating the area surrounding the hiatus provides visibility. And after that, you have to insert the catheter into the hiatus for 2 to 3 inches or until urine begins to flow. Female urethra is approximately 1 to 1.5 to 1.5 inches. So we have to put inside. So if the specimen is collected, pinch the catheter with the thumb and the finger while placing the specimen container in position. Urine will flow out of the catheter if lumen is not occluded. So after that, rest the hand in the pubis area. Then, while holding the catheter in place to prevent pulling and pushing the catheter, withdrawing the catheter and pushing it back in the urethra, increasing the possibility of contamination to the urethra. After that, you have to connect the catheter to the urine bag so that the urine will not leak from the bag and maintaining its sterility. So I have here the urine bag. So I will connect now. So now we can let it go. And after that, inflate the balloon 10 to 15 cc of the sterile water using a 15 to 20 cc syringe, making it sure that will be no leakage of water from the balloon. This is served the purpose of occurring into the bladder. So we have to use a syringe. Then we have to put inside. After that, secure the dwelling catheter by taping it to the patient thigh. Allow some slacks of the tubing of accommodate the patient's movement. This is to secure the catheter properly. slacks prevent tension on the catheter when the patient moves and place the urine bag in a movable part area. So, I will take here. Then place the urine bag in the movable area. And now you can go ahead remove your gloves. After that, you can place the patient comfortably. This is to provide relaxation to the patient. So, we will discard the gloves. So, ma'am, pwede na kami idabalik kung tarong ma'am. So, nasisilaw ng ma'am. After that, you can do aftercare. So, ma'am, humana ka sa ato insert sa catheter, ma'am. Before ko maghawak, ma'am, tama kayo dahil pauntan, ma'am. Okay, thank you. Thank you kayo sa mga cooperation, ha. Okay, thank you. And after that, record the time of the procedure done, amount, band color of initial output. Cleansing the environment promotes comfort to the client. Moisture as a good environment for bacterial growth. So, the time right now is 2:30 p.m. and also the initial color of the urine is slightly yellow with cloudy characters. That's all. Thank you.